Hello, you were Nick Rheinberger. This is 97.3 ABC Illawarra Mornings. There is a new national stillbirth plan being put into place. It's actually come through the actions of Senator Christina Keneally, who had a stillbirth child some years ago. We're looking to halt the high rates of stillbirths in Australia, especially amongst Indigenous women. The national stillbirth death toll is about 6 in 1,000 births, about 6 babies per day. And amongst Aboriginal women, it's more than double at 13 babies for every 1,000. The Waminda organisation have been advocating for a program called Birthing on Country, which helps pregnant women stay in touch with a midwife throughout their birth, and to give them culturally as well as medically appropriate help to give birth to a healthy child. Yesterday, I caught up with one of the midwives from Waminda. Her name is Melanie Briggs, and she explains how this technique might work and why the statistics are so alarming.
Nationally, I've got some recent reports from the Australian Institute of Health and Welfare Stillbirths and Neonatal Deaths in Australia report that was done in December 2020.
Right.
So what I've found in that report is that Aboriginal women accessing antenatal care before 14 weeks was around 59.2% compared to 64.3% of non-Aboriginal women. So this is significant because to get early access to antenatal care, we can then identify if there's any significant issues with the baby at that point. So, when you look at the national statistics for perinatal mortality, the main contributing factor is congenital anomalies. So, and it's usually picked up in early pregnancy. So that's why it's really crucial that women get early antenatal care. And then if you look at the birth weight of babies, so babies that are born, at 2,500 grams, so 2.5 kilos or under, that's a low birth weight baby. And nationally, the number of low birth weight bubbas is 6.2% of Aboriginal babies compared to 2.4% for non-Aboriginal babies. So that's like 3 times higher. And birth weight and premature birth are major factors and cause, chronic disease in babies, and they also lead to, very unwell babies at birth, and, if they do survive. So it's quite significant to ensure that our women, receive early antenatal care, good quality care during their pregnancy, so that we can help them, get good education around lifestyle, food and nutrition, and what's normal growth in pregnancy, what's normal movements of baby in pregnancy, how to talk about reducing smoking in pregnancy, and all of those lifestyle factors that can be easily discussed and in a space where it's free from judgment and stuff like that. So and nationally, stillbirth in 2018, 11.5% of Aboriginal women compared to 6.7% of Aboriginal women have been reported to have a stillbirth. So that's double. It's quite significant.
That's huge.
Yeah, and neonatal death in 2018 was 4.8% of Aboriginal babies compared to 2.1%. So that's more than double who died at birth. So,
the technique that you and Waminda recommend is what you call birthing on country. What does that mean?
Yeah, look, birthing on country it's not a new concept. It's actually been around for a very, very long time. So Waminda has had a goal and a vision to have a safe birthing space for women and a healthy program to wrap around them and enable babies to thrive and grow. So this is not new for Waminda. And 4 years ago, we were approached by Queensland University and a national birthing on country strategic committee that was formed by the Australian College of Midwives to be the regional site for a birthing on country model of care to be developed, implemented, and then researched and evaluated by the National Health and Medical Research grant, which is building on our strengths, which is now over in the Molly Wardaguga Research Centre through Charles Darwin University. So 4 years ago we were approached and we accepted. So now we're the regional exemplar site for the country. And so basically Waminda, we are not a clinical medical service as we're not the same as an Aboriginal medical service. We're an Aboriginal community controlled health organisation. So we're very specifically focused on addressing the social determinants of health and understanding, what are the barriers and what are the challenges our women are facing in community to enable them to access, high quality maternity care. So
but you're a midwife, so you would be directly working with some of these women, wouldn't you?
I am. I that's my Monday to Friday position. So I provide antenatal and postnatal care in community and support women in labour and birth at the hospital. So I'm very lucky enough to have the relationship with women in community and be able to follow them throughout their whole pregnancy journey and watch their little babies grow. It's pretty special job to have.
So a lot of what you were talking about was the pre-birth care that the midwife has a relationship with the mother for all of those months. What about with the birth itself? Did you say you wanted a dedicated birthing unit? Did you want something within the Shoalhaven Hospital that's specifically for Indigenous women? Is that your ideal situation?
That is exactly what it is. We are planning we will have a birth centre for Aboriginal women in the Shoalhaven region, and it will be side by side with our local health district because, as we know, we have across the board, we have a number of women that need that higher level of care, such as an obstetrician or needs to have a consult with an obstetrician at some point in a pregnancy because it's just gone outside of the standard scope of practice of a midwife. So we need to collaborate and work with our local health district so that we can provide that support in the hospital as well as a birth centre that's community controlled. So the aim that what we are doing is we are lobbying to have an Aboriginal community-controlled, governed and led birth centre in the Shoalhaven on Yuin country so that our women can come in and have their antenatal care. And then if they do go outside the scope of the practice, we can go with them at the hospital. So, if they become a little bit more complex, we can go with them to the hospital and birth with them there. But for women who are low risk and have no obstetric complications in their pregnancy, they can then be birthing in the birth centre. And that birth centre will also be prenatal care and postnatal care and child and maternal care. So children up to the age of 5 and, having that allied health services such as OTs and speech therapists and paediatrics and and in pregnancy care, obstetricians and gynecology as well. So we're looking at the whole wraparound sort of child and maternal care in that one centre.
That's Melanie Briggs, midwife from Waminda, based out of the Shoalhaven.